Ru, thank you so much for agreeing to be interviewed today. I wonder if you could introduce yourself to us.
Oh, it's such a pleasure to be asked. Thank you, Emma. My name is Rupal Shah. I work as a GP, as you can see, and also as an Associate Dean, and I lead on the Enhancing Generalist Skills programme for London, and I work within the professional development team as well.
Thank you. Could you tell us a little bit about your research and the areas that interest you as a doctor, a writer, and an educator?
I'm a GP, and I'm really interested in person-centred care. In particular, narrative practice, emotional engagement, the role of boundaries, the effect of context on our ability to connect with our patients, and the practitioner's role as witnessing someone is suffering, for example. I'm interested in whether not being able to give person-centred care in this way is a source of moral injury and whether it contributes in the end to burnout.
Thank you. You've been a really valuable contributor and supporter of the Workforce and Education Research Catalogue, or WE-R NHS, hosted on NHSE's Learning Hub. Can you tell us 3 top resources that you've contributed to the catalogue?
So I'm proud that with 3 other colleagues, I've written a set of 6 articles introducing a new 4-domain model. You could use it as a consultation model, which incorporates all the elements of person-centred care that I mentioned previously. We called it the hermeneutic window model, hermeneutic just meaning creating meaning for ourselves and for our patients. And you can find all of those, I think, in the catalogue. You wanted 3, didn't you? So
I did. I was going to ask you, are there 2 more that you could tell me about?
Sorry, I thought so. There's the differential attainment toolkit and a paper which I've written myself. So I was involved in creating the differential attainment toolkit for London, along with the team. Jackie McDonald-Davis is the lead, but there's quite a lot of resource in there. So I'm quite proud of that. I think proud of being part of it, not proud that I did it. And the third thing I'd say is some videos that we made featuring patients with mental health difficulties and their experience of the healthcare system, which I think are quite powerful. And you can find them in the generalism folder, I think.
Thank you, Ru. Thank you. I know that you have a particular interest in quality improvement work. Do you have a vision for how the WE-R NHS catalogue could play a part in this kind of work?
I'm really excited about it. I think potentially it's got a big part to play because people hopefully can go onto it and see what colleagues in other regions have been doing. And it's maybe the lower level stuff that doesn't necessarily get published in peer-reviewed journals. So if you were to, look on Google Scholar, you wouldn't come up with any of this. But having it on in a catalogue like this really, I think, makes important links and helps to prevent duplication. I think it allows people potentially to connect to one another and to find out more about the type of work that's being done. So I think it would really improve quality potentially. So I think it's really exciting.
Thank you. That's super. And last question, what's next for you in the areas of health and workforce research that you're interested in, perhaps in the next 3 years?
I've been thinking a lot about how context affects the way in which we practice and the way in which we can offer person-centred care. So I've just started co-editing a textbook for Routledge on finding and creating meaning in healthcare. And this will be quite a practical guide of how we can do this in spite of the context that we're working in. I think it fits quite well with themes of generalism. So that's a big project. The book Fighting for the Soul of General Practice came out in January, and there's a few podcasts I'm hoping to record on the back of that.
That sounds absolutely brilliant. Thank you, Ru. Thank you so much for your time today. And yes, hopefully we'll be talking again soon. Thank you.
Lovely to see you, Emma. Thank you.